Department of Education in the Office of Early Learning. And and I'm going to go to my left and have Becky. We'll just go around the room so you all know who's with us.
Good morning. This is Rebecca King in the Office of Special Program, and I coordinate school health services.
Tracy Dalton, Head Start State Collaboration Director. Missy Smith, West Virginia Department of Health and Human Resources, Division of Early Care and Education.
Ginger Hoffman, Preschool Coordinator for the Office of Special Programs, Department of Ed.
Monica Delamay, Lead Coordinator, Office of Department of Education.
Jason Roush, State Dental Office of Maternal Child Family Health.
And I'm Teresa Marks. I'm the Oral Health Program Director for the Oral Health Program through the Office of Maternal Child and Family Health.
All right. Before we get started, just a couple of things. I've muted everyone to make sure that we don't have a lot of background noise. If you have a question, you can either use the dashboard to raise your hand and we'll unmute you individually, or you can type in the chat box your question and we will maintain the chat box as well. So I'm going to hand it over to Becky to begin.
All right, I just want to post up here quickly just our webinar objectives. And remember, this will be recorded if you need anything from it later. We will also be posting this as a link on the Marshall University School Health Technical Assistance Team's webinar site, and that's where the school nurses usually go to pull the recordings. And we'll just link right over to Janet's website here, the Office of Early Learning. All right. Big question is, and I hear from a lot of people, why are schools responsible for this, and why do students need a dental exam? Because we start to think, oh my gosh, we're doing everything, and sometimes when is there responsibility down the line? But at the end of the day, we know we work as a community with our students, with their families, and with our local partners, and we want to make sure they're healthy and they're ready to learn. So as we can see, when you look, there's a lot more to it than just math and science. When kids walk through the door, we know that's probably the last thing on their mind. So we want to make sure that there's some checkpoints in place. The status of oral health, and I'm going to tag team here with Teresa and Dr. Roush. As you can see, and I always laugh and say, okay, guys, everybody's got millions of absentee hours related to some type of chronic disease. So we giggle because asthma does show there are several hours missed of the day with asthma. But 51 million school hours actually documented nationally for a dental-related illness. And I'm going to let Teresa and Dr. Roush tell us a little bit what they see on the surveillance. And we thank you all for working with our state DHHR Oral Health Program at Marshall University to get in there and allow them to do surveillance so we know our status.
Right. This is Teresa Marks. Our West Virginia data shows us that up over 50% of our students who are entering school, so that's our universal pre-K and kindergarten enterers, are have had a caries or a cavity experience. And we also know that that population, 1 in 5 of those kids, a little over 20%, have active untreated decay when they're coming into school. So that is why, you know, we need to address this issue because there are health issues ongoing even when they're coming in. And that's what we know in West Virginia. We also know, and we have a focus, and we'll talk about additionally with the Oral Disease Prevention Project that's part of the supporting this dental exam piece in the new policy. Only 1 in 3 kids have sealants on their teeth as well. So that's a very good, it's an evidence-based preventive strategy that we're trying to put forward as well. So we want to increase those numbers and, of course, increase our kids' dental exam, lessen the disease or caries experience when they're coming into school in the state.
All right. Thank you, Teresa. All right. So what's our vision? When we talk about a dental examination, and we start looking at the health of children in schools. Our vision, of course, is community schools. We want every school working with the community. We want to make sure that we close the gap and that we're able to support the needs of our students. And we can't do it alone. We have to reach out to our community partners. We want to ensure they have a medical and dental home. That's huge. Those are our partners. And at the end of the day, we really are an integrated medical home, working with school nurses and working with staff, because we're looking for deficits that are educational. We're also looking for health deficits. So we've kind of, what we're seeing are some checkpoints to promote health and wellness for academic success. And at this point in time, we have new enters coming in, and we're looking for immunizations and health check. And this year, this coming year, we'll be looking for a dental exam. As we move forward, we will be looking at grade 2 for the dental exam. And at grade 7 and 12, we already know we're looking for immunizations, adolescent vaccinations, and again, we'll be phasing in that dental exam. The health check at this point in time, our child visit, is only a requirement for new enters. So everyone out there may say, what is a community school? So I'm just going to give you a brief description of what it is. Basically, it's a school participating in community-based efforts to coordinate and integrate educational, developmental, family health, and other student services through partnerships and community-based organizations, public and private entities, families, and other stakeholders. And you'll probably hear Dr. Roush talk a little bit later about public and private partnerships. So, and he's went nationally with that, and it's a great thing. This is what it looks like when we talk about the old dial-up phones compared to our new electronic phones. It's like an app, and where do you go to get those? Of course, as you see, we're going to all fall under that health and social support internally and externally. And part of that community school is engaging instruction, extra learning opportunities, early childhood development, and that's where you all are here. College, career and citizenship, community engagement, family engagement, youth development, and strategic alignment, which there's lots of other pieces that would interact. But at this point in time, we are focusing on the health and social. The State Board of Education does have a policy that was passed last spring, and it's Policy 2425, Community Schools Promoting Health, Safety, and Well-Being for Academic Success. And that's the logo, and you'll be seeing a community schools guide coming out here in the near future. Just another little funny to remind us all that kids bring a lot to the classroom, and we need to remember that, and that's part of looking at the whole child. All right, here's where we are. We want to talk a little bit. Let's get into it. Where in the world is the dental exam policy, and what's it mean to me, and where do I have to go? The dental exam was added to State Board of Education Policy 2423. And in that policy, it was renamed. It was called Communicable Disease Control, and it was renamed also at the end of the spring to be called Health Promotion and Disease Prevention. And we went ahead and thought, hey, the only place that we have all of these entry-level screening requirements are in our pre-K policy, which is fabulous, and it's always been a holistic policy with a community school concept behind it. So we felt we'd probably better add it to other policies since this extends beyond pre-K. So we incorporated it into this policy. It also includes our immunizations, the health check requirement, along with TB law and things like that. So health promotion through school screening examination. It's Section 5.3. And as you can review and see, we know there's a lot of concerns in Dr. Roush and his program, and we're all going to assist with this with looking at workforce. So it's a phase-in. Next year in 2015-16, we'll see the new enters in pre-K and kindergarten. I underlined a few things, as you can see. They should have on file. That's the same language we use with the health check. And when we're referring to this, overall we refer to universal pre-K. We do have Tracy Dalton talk a little bit about Head Start. So all of you from the Head Start community and all of us, we know Head Start children are in what percentage of our classes? 60%. So we're all going to It's one of those balances between state laws and also federal regulations, and we know our Head Start kids are going to have some extra requirements. Should, you're right, it doesn't say shall. The only thing we remove children from the classroom for are vaccinations. So we are working towards making sure they're healthy and learn, and this is a should. At the end of this policy, and here's the shall piece, is making sure the exams are signed and dated by the student's dentist and completed within a 12-month period. The other piece to this policy, because we know all children aren't going to show up with a dental examination, so our fallback piece is the West Virginia DHHR Oral Health Program, their Oral Disease Prevention Project, and that's going to allow for them to help set up an oral health assessment. It could be by a dentist, but most likely it's going to be by a public health certified dental hygienist. And this would be, and we'll talk about it more, this would be with the parent consent. So we have a fallback if kids can't get there or you don't get their dental exam. We also know out there we have lots of HIPAA and FERPA forms, and we can share that for Janet to post on the website. But sometimes they show up and say, oh, I'm going to get it to you, and they never do. If you get the form signed, then automatically that dentist can fax it to you, and it kind of cuts out the middleman or the parent having to worry about that if the parent wishes to do that. Here's the phase-in plan, so we can all look at it. We know everything's not perfect. It's not going to flow just perfect, and this is why it's a phase-in. We're going to work on it as we go. And Tracy can tell you from her many years of trying to make sure she gets dental providers to the children in the Head Start programs that it has been a challenge, and it will continue to be a challenge, but luckily our oral health program is working on it. So 2015-16, we've got pre-K and kindergarten. So in red, you'll see where we're adding. 16-17, we'll be moving right along and adding grade 2. In 17 and 18, we'll be adding grade 7, and then in 18-19, grade 12 as we move through this. So pretty much our last chance to try to make sure they are going and visiting. And a lot of people say, hey, we got this dental exam. What about, a health check and a well child visit? Because we know adolescents do not do that. We are looking at it at this point in time. That has not happened. And Dr. Roush, I have reasons where I like grade 7 and 12. Of course, we know it's a checkpoint for adolescent vaccinations. Of course, the science and the reasoning behind grades the 2nd, 7th, and 12th, if you want to share with them why these checkpoints.
Well, so the second grade and 7th grade are great years. That's when the permanent teeth are becoming in the mouth. Second grade will have our six year molars. 7th grade will be when the kids will have their 12 year molars. So that'll give us assured that they have sealants placed on those teeth. So that's the reasoning behind the 7th grade, and then it's also consistent with our immunizations. So those are critical years. So we want to put sealants on those teeth as soon as they come into the oral cavity. Plus, it is consistent with our other programs.
Mm-hmm. Okay.
So Becky.
And when we talk about the policy, we're talking about new enters in pre-K and kindergarten. So we know now, and we have all of our universal pre-K ladies around the table, and I'm sure there's many gentlemen out there as well, but the ladies are at the table today. When we look at pre-K, what percentage enter in pre-K, brand new?
We are at 73% participation rate, so about 73% of the population attend pre-K.
Okay, so that 73%, as they move on to kindergarten, they do not need to show proof of a dental exam. They showed that proof back in pre-K. So at this point in time, then we will be looking in kindergarten at the 27% that enter who are new enters and have not shown proof that they completed a dental examination. And it's the same that we do right now for the health check. So when we're looking for a comprehensive physical, we ask for new enters. Now, if your county goes above and beyond that, that's the county piece. But at this point in time, we're only looking at new enters in kindergarten. All right, another piece of this policy, and as we started discussing it, it's the quality concern. And we hear from principals quite a bit, and they get concerned saying, oh my goodness, am I responsible if I bring a dental hygienist or a dentist in here for their standard of care? And we all know that's a huge concern. Same thing even when you have a school-based health center, anything that's coming into your school providing services. Of course, parents are thinking, oh my, the school's reviewed all this. Of course, we've made sure the folks are safe. But at the end of the day, the quality assurance piece that was placed in this policy, and you'll see any community service performed in the school setting should be regular and ongoing. And that's how you decide regular and ongoing is with this community service provider. But they should be evidence-based or promising practices and follow best practices and guidelines. For oral health, as we look at school-based oral health services shall incorporate the protocols set forth by the West Virginia Department of Health and Human Resources Office of Oral Health Programs. So that is one thing that Teresa and Dr. Roush will be working on as well. But they also follow their daily standards of practice, and you all can add to that.
I was going to say we have completed for the Oral Disease Prevention Project, there is a manual that is available for those practitioners who will be providing those services within the schools. And, it has been, just as Becky mentioned within the policy, it's evidence-based. There are, standards of practice, infection control, disease management, OSHA regulations. It takes all of that into consideration. There are templates for, reporting, consent. It's pretty all-inclusive. And that is part of the project when those services are going to be provided within the school. The manual has been developed internally to make a standardized practice for those services to be available statewide in the school.
And we will also provide a link over for Janet. Although you're not responsible, it will be something you want to provide. And if you're doing MOUs, and we also in the future will have, and we have some now if you need it, sample MOUs to work with dental service providers within the school system. And as we move forward, there may be a little bit of grant funding, and that grant funding could be used for multiple things, and one of those may be busing. I look at Tracy because I know sometimes that's a concern or issue trying to get kids to a dental practice, because we hear folks say, wait a minute, the dentist is not too far away, or the clinic, if we could just get the kids here, do we really have to move them into the school? No. It's a local issue. You're working with your community. So that's one of the ideas behind having these small grants, is for everyone to get together and think about what do we really need and how do we do it. So that's in the future. We are working on it in the process, but of course we don't want to get anyone's hopes up until it all gets here and everything works out. As you know, we have a lot of hoops to jump through sometimes, which are good hoops, but it just takes a while. What does it mean? When we look at what does this really mean and what do I have to do? Well, during pre-enrollment, and hopefully it's plenty of time before the actual class begins, during pre-enrollment we need to request a parent or guardian bring in proof of dental examination completed in the last 12 months of pre-enrollment, or the day they bring the exam with date and signature of dentist. So we get a lot of calls on that. Say, well, pre-enrollment was in April and they're bringing it, or, here it is August. Well, at the time they bring it to you, it should be within 12 months, and that just makes it easy. Now, when, Tracy will be talking a little bit, and if anything doesn't match up with Head Start, she will get us back in line with the Head Start. At this point in time, 12 months, that's what we do with Health Check right now as well. What are the concerns? These are just a few I listed. You all can probably list a whole lot more, but I know for me, it's always been the concern of the lack of dental insurance. And yes, although we'll even hear that state workers have dental insurance, it's an option. So you don't have to choose that option. And statewide, I think we see that even with the Affordable Health Care Act, it's an option. Yeah. So that's another piece of all of this. But we also know that, what are we looking at, 62% of our kids have Medicaid or CHIP at this point in time. So we're looking at
we think about 85% of the kids will have some type of dental coverage.
Yeah.
fabulous.
It's high, though we know the utilization rate, which is some of the concerns in talking about access and things of that, is below 50%. So they have the insurance, they're not able to use it. So it's an access, which again is a good collaboration with our school system, because that's where our kids are. That's an active point to capture them and get them that access.
And we do have lots of tools in the toolbox, because just recently our state has contracted Medicaid with the transportation and working on transportation statewide.
Yes.
So that's another piece. They will pay for transportation, and we are setting that up and linking as well. So that'll be another added positive for all this. But we also know that there's a lack of dental providers in many areas, and we've really pushed to get dental hygienists to be certified public health hygienists, and that gives them a certificate and allows them to at least come in and get an assessment and try to get the kids who have critical needs into a dentist. They need to see them within 6 months after the dental hygienist has done an assessment. But we are still, workforce continues to grow, and they continue to write grants for workforce, and we're working on that. We know we want them to have a dental home in their local community, number one. That's what we want them to have. At the end of the day, if it doesn't happen, there are multiple routes to where we can at least start getting some services to them until we work on the workforce piece in your area. Anything to add?
As far as I think the policy does specifically state that the children will be seen based on their ability or inability to pay. So cost, it is not an issue. The kids should still be able to get to prevent service. Just can't get that service, especially in that school setting.
Right.
And the fallback plan is that hygienist and the public health piece. And when I think when we talk about private and public partnerships, the idea was to force as many of the kids to the private sector to get the dental exam, and then we use that school setting as that catch piece. And so so when we talk about that partnership, I guess that is a true partnership, and that we have the private sector that gets the first try, and then we use that school setting kind of to as that fallback piece. But then ultimately, we want to make sure the kids do get back into that private sector or safe, some type of safety. What safety is it FQHC or the school-based center? But as long so we are trying to establish that the overarching goal is that home. But I guess it's important to make sure they get the preventive service.
Okay. So I've got on here, we're going to discuss it a little later, documentation and children in Head Start. So no, we have not forgotten that. This piece here, I'm going to move over to Teresa, and this was created by the Oral Health Program, and it kind of helped all of us say, okay, we're starting to understand what you're looking for.
And this is just, a flow chart. We like flow charts and public health and all that good stuff. So you'll see in the upper left-hand corner, this is where we are. We're looking to see, again, if it's an oral health exam by a dentist for new enterers in West Virginia Public School, pre-K and kindergarten, and then, of course, with the phase-in that we've already discussed, we'll be looking following in grades 2nd, 7th, and 12th. So we're going to be looking for, if we go down from that box, again, a parent or guardian that submitted documentation of a completed oral health exam to school personnel within 45 days of the start of the school year, or enrollment, as Becky mentioned earlier. So then, we're basically going to ask ourselves the question, yes, they did that, or no, they did not. So let's look at, yes, they did that. We go to the right. We have that documentation of the oral health exam. It's going to be inputted into that child's school health record by a nurse or other designated school personnel. And we'll talk a little bit about that. We're also going to have some other data input, and as Dr. Roush has talked about with our public-private partnerships with the private sector, some of that responsibility will be by the practitioner or the office themselves as well. So that's not going to all fall on school personnel. If we go to know that child does not have that documentation of an exam, we're going to look at that again with parent consent or guardian consent, enrolling that child into our West Virginia Dental Prevention Project. Also, as it was said in the policy, it's called our Oral Disease Prevention Project, and that's where they're going to receive that school-based dental assessment. Most likely, the model, again, we have is through a certified public health hygienist. And then if we went that route and they received an assessment, they're going to receive that assessment, and they're going to receive that in the school setting. And both of those, either the exam or the assessment, will be documented in the school health record.
And note that oral health assessment will be with a parent consent. We want to make sure a parent's going to consent to someone looking into their oral cavity, and that's part of our entire HIPAA, FERPA, and everything else. So we want to make sure that's in place. All right.
So that school visit's going to be more than just an assessment. So there'll be an assessment. The child will have their teeth cleaned. There'll be a fluoride varnish application, sealants. So they'll get all those preventive services. Mm-hmm. And then we're going to help with some care coordination and try to, so we're working back in for restorative care.
Right.
Wonderful. And we know some of you already have existing dental programs going on and a lot of great links, so that's a plus. And we already know that 60% of our Head Start students are required to have a dental examination. So it gives us a little bit of a, no pun intended, head start with this policy. All right, fact. A school toolkit will be rolling out, and one of the developed pieces are myths or facts. So this is a fact. And we'll be seeing a lot about dental sealants in the future. So just so as we go along, there's a lot of great things, if we know, that can really prevent dental decay.
I was going to say the other thing, if we want to talk about, evidence-based practices, that's what we're all about. Sealants are evidence-based practice in dental, public health, and also fluoride. So that's, Dr. Roush mentioning the fluoride varnish treatment, some of our schools, and we really appreciate those who participate in the fluoride rinse programs through our regional oral health coordinators. Those are the two preventive measures that we're really pushing, because those are our two evidence-based preventive measures that we have. Let you know.
Something I think we really need to try to start defining is what's a screening, what's an assessment, and what's an exam. And when we rolled out the Governor's Kids First project around the entire health check and comprehensive physical, a lot of confusion, especially we had a lot of teachers that came to the regional trainings and at the table, and they were like, we already do this. We already do this. We were like, wait a minute, this is really a physical examination. It has some screenings incorporated, but we're talking about comprehensive physical done by a medical provider. So it's, in essence, kind of the same thing, but we want to make sure we review, and this is also going to be as part of the school toolkit for school personnel, and there's another one for parents. So I'm going to turn it over again and let Dr. Roush and Teresa talk a little bit about what are the differences.
And I think Dr. Roush and I were discussing this just before we started today, and I think the easiest way, and the way he put it, is very simple. The difference is the healthcare practitioner who's providing the service. So if we look at an oral health screening, that is going to be completed by a nurse or a medical provider. So that is something that's, of course, in our world, a non-dental provider. So you can see the definition, what they're going to look at there to see if they have possible concerns in the oral cavity, their teeth or their mouth, and they're going to use that screening to make a referral to a dentist. An assessment is completed by a dental hygienist. So again, they're still going to be looking in the oral cavity, perhaps with the aid of an x-ray. And with our current scope of practice for dental hygienists, we've talked about, and that's where our certified public health hygienists come in. They can provide that assessment without general supervision, and they can, but within that, you see the last line there, they need to have made a referral, and that child needs to be seen by a dentist within 6 months. Finally, the dental examination is completed by the dentist. So that is, as Becky has inserted there with our red text, that is our, if we want to say gold standard or our focus for this new requirement. We want those kids, again, to have dental homes to get that assessment. Now I'm even confusing the terms. We want them to get that examination for their dental health. If they don't have that examination, as we just went and looked through the flow chart, they're going to get that assessment, but then within that 6-month period, they're going to be referred back for that examination. So that's kind of the difference, is the person who actually provides the service.
And really, I mean, let's concentrate on the last two, and I mean, let's try to forget about the first one. I mean, our focus should be on exams and assessments, and let's move away from screenings.
Yeah. And the key point for all of us, we know we get a health check, and we know also on WVIS on the web that we have a place that says oral health screening. And we look at the profiles that the Office of Early Learning puts together. We'll see the weakest area is the oral health screening. So we automatically know it's not an area of comfort for our medical professionals. School nurses are used to looking at mouths every day, and they usually do it on an individual basis when there's a complaint. But that oral health screening is part of the health check exam, but it's really getting at trying to get them to the dentist, and it's asking when was their last appointment with the dentist, and picking up on any needed issues that need immediately addressed without technically trying to diagnose something in the mouth. All right, thank you. So screening, assessment, and exam. And at the end of the day, the biggest focus is we want them in a dental home and getting a dental exam. Our last resort is trying to get assessment.
Mm-hmm.
All right. Importance of working with local dental providers and establishing a dental home. Dr. Roush briefly talked about this, and I'm going to turn it over, and this is his public-private partnership, and he did. He went into it, but just to reiterate a little bit more of why we need to work locally.
Well, I think the most important thing is that with oral health, I mean, it's important to work in both the I mean, I think we have to work with the private sector one, because that is where the majority of our workforce is. So basically, I mean, this has been a dental, something that the dentists have advocated for I think 4 years, mandated dental exams. So knowing that they were interested in those exams, it made sense to develop a policy that one, that we utilize that workforce. But I understand, that a lot of the, dentists in some areas, it's tough to get these children seen. In fact, we're seeing the children too late. The standard of care, for a child is to see their dentist by age 1, and that's why so much of our high decay rate on school entry. But this policy will start putting some checks and balances in place, and then we'll put more focus on that age 1 dental visit. But we have to utilize the private sector, and there's a lot of ways to do it. The private dentist could hire a public health hygienist to go into schools and provide those services. FQHC could contract with a dentist to provide those services, or an MFQ could be established with a free with an FQHC. So there's a lot of ways to ensure that these services are being provided. But the first step is let's try to get them into the office. And then hopefully majority of these kids will be seen, by that private sector or those clinics, and then we're just going to use that the school as that catch. In theory, as we go from school entry to 2nd, 7th, and 12th grade, there should be a less demand on the safety net piece, because we're trying to establish the home. We want that kid going to the private sector or the clinics. Right. So in theory, if we see him in the school setting, the law says that they have to see a dentist within 6 months. So they should be, that should establish that. So in theory, as we move through the 2nd, 7th, and 12th grade, there should be less demand on that, on the catch piece or the safety net or the.
And that's the dental hygienist when you say the
yeah. There should be
less of
the
dental hygienist.
Yeah, the hygienist. Yeah. But the thought is that we need to utilize the services that are within the scope of practice, and the hygienist can perform those services in the school setting as long as they have a collaborative agreement in place with a dentist. So I hope that kind of explained that relationship.
All right. What is the required documentation? So they're going to have to provide proof that they had a dental exam within the last 12 months at the time of enrollment or your pre-enrollment whenever you're making the paperwork due. And at minimum, they must show the date the exam was given and the dentist's signature. So we're looking at the date the exam was given and the dentist's signature. There is no special form to show proof of an exam. Now, some people will be saying, hallelujah. Others will be saying, what? So we know we worry about the dentist being overloaded, and you hear that about any form. And I know school nurses deal with forms all of the time and have a lot of issues and angst from providers with medication forms and different things. So there is not a special form on this. It's basically showing that proof. And as we move on temporarily, we'll be providing space on WOW that will allow you. Right now we have remember the oral health screening. So we'll be providing a place for the dental exam to be able to collect the dentist, the date of the exam, and the dentist as we move forward. So in the future, again, we have another future project that we are working on and moving forward on. We'll have an oral health database populated by dental providers, which will talk to WOW to share dental exam and oral health assessment information with schools, and it will be a single point sign-on. School nurses will tell you we've been looking at it the past couple of years, and we're to the point now. We are getting contracts in place that we're going to have a single point sign-on with the immunization registry. That way, when you sign on to WVBE and you're looking at your screen, and if you have access to immunizations or dental, you could go to that, and it would be showing you what the dental providers have placed in there. Same thing with vaccinations with the medical providers. So, but we're also going to allow for a place where the schools can add data, because we know data has been an issue with providers entering it. So there will be writability, but it'll show more of a historical perspective, so everyone will know it didn't come straight from that provider. So as we move along, we know duplication of data entry is an issue, and we know everybody's trying to do that and have been doing it, and we need an integrated system where we can all work together at the end of the day. And I know some of the red flags are, oh my goodness, are you crazy? This is a FERPA and a HIPAA issue. But it becomes a public health requirement for a dental examination, so it will not be. Same thing with the vaccinations, it's a public health requirement. So now we're going to talk a little bit and let Tracy tell us a little bit about what Head Start needs, because we don't want to confuse everyone.
Well, let me just say that oral health as a service and as a component to health and being emphasized has always been one of the hallmarks of Head Start now for many, many decades. And knowing that good oral health is essential to healthy development overall and learning it has always been viewed as a critical component. And so it's very exciting to see that health promotion across all areas, but in particular oral health, that we're arriving at this policy and these practices. So it's a great thing for kids. And so much of what has been discussed today is certainly in line with Head Start requirements. Medical homes and dental homes, again, have always been a hallmark of Head Start. And I think we are fortunate in our state that our universal pre-K program is so collaborative with Head Start, with 60% of the classrooms having Head Start services and children and staff located in them, because that means potentially, 60% of those kids already have been, accessing oral health, let's hope. But in theory, they should have been. Now, much like what Becky said, that a child could not be kicked out of school for a lack of seeing a dentist, Head Start also sees no benefit into removing children from programs based on families' inability or potential unwillingness to receive a service for their child. However, because of that, Head Start has a huge support component and has staff. Both they have health managers that are typically nurses, as well as family service, family support. They might have different titles from program to program to assist families in receiving services such as going to the dentist, going to their medical provider, etc. And so I just also want to take a moment to encourage all the local collaborative teams to work together on, many of your kids have already been doing this. How has that been working in your county? Perhaps not everyone knows how that's been currently working, and it's another good time for the team to come back together and say what practices are already in place and how can we build upon those to extend to maybe some of the other children that weren't receiving those additional support to get connected with a medical home or a dental home in this case. And so I just wanted to make everybody aware of that. In regards to documentation, I think Head Start is very similar to many other systems and services. A standard is established, but dictating how something may be documented may not be, it may not be directed at the program. It may not be explicitly stated. And so here we have a similar thing. There are requirements that are similar to what you've said in regards to every Head Start child. Every program has to ensure that they've been connected with a medical and dental home, and they also have to have systems in place to track not only that they've received service, but if they need additional treatment, that follow-up and things occur. And so, again, I think it's very in line with everything that we've discussed today. It's just going to require teams communicating around this topic and talking about how that's working and ensuring information exchange across all those individuals or parties that are on a need-to-know basis, and to ensure all the data gets into all the data systems that they need to get into, because Head Start is already reporting on dentals to the federal government, and so each program's already got a system for tracking and how that's working in cooperation now with WVBE and things like that. So I think those will probably be the critical points to emphasize here.
Thank you. Anything, Missy, to add for child care? Okay. I'll leave Missy out. Okay. Key strategies. So I'm going to move back over to our oral health team and talk about key strategies. And one of the pieces that Janet just mentioned, if you'll include, will be follow-up as well and what you expect.
So. We have, and I believe, are these available, or people, participants seeing these?
We will make those
available,
yeah.
We have a, I will say, draft toolkit, the beginnings of a toolkit available. We've been working on this the last few months. Again, wanting to get as much information about this new initiative and the Oral Disease Prevention Project in and of itself. So there's going to be an outreach to, staff, school staff, through the toolkit. We're also, of course, looking at our different audiences and what messages they need. So there's a specific piece to address parent or guardian concerns and just the general public or community through that toolkit. So some strategies as well is, working within communities to make outreach to a local dentist and or again, public health hygienist. We'll have some templates for being able to do those and make those connections as well. Again, as we've talked about and Tracy just spoke, Head Start already has the dental exam requirements that's going to cover a certain percentage of our school enterers as we move forward with the 2015-2016 enrollment period. We'll have, again, and have the infrastructure in place to provide school-based dental services for those students who have not had that examination at the time of enrollment. Again, we'll be working and utilizing our workforce, specifically those public health certified dental hygienists, to assist with assessments for those students who have not had that exam in the school setting. And then we also, through the oral health program, partner with Marshall University, and we have regional oral health coordinators. There are 4 throughout the state that are going to be working with our regional wellness specialists as well through the REFAs to be able to provide technical assistance for this program. Education's mentioned there. We have oral health grade-appropriate curriculum available that they can assist with providing as well. And again, I mentioned earlier our preventive evidence-based strategies. We have fluoride rinse programs that are available, and then just in general oral health support from their years of experience. They're 4 registered dental hygienists, so they have that expertise and that knowledge base to be able to help everyone. So that's what we're looking at.
All right. So we'll open this up for questioning and answering, but I'm going to just move to the next slide and quickly. This is in the school toolkit, and it basically says, should we include a dental screening or an assessment in the pre-enrollment day? And we know it's very hard to chase things, and we like to get everything out of the way on that day so we can move forward because we're all overloaded and doing many jobs. But no, the focus of this is the dental exam. We really want the dental exam. Again, I will share with Janet the HIPAA, FERPA forms that we've had out for a long time, or talk with your school nurse. He utilizes those. That way you could have the parent sign off and then chase it electronically and try to get it. So that's one of the biggies, is we really want that. Now, at the end of the day, if you do not get the dental exam, that's when we kick into the oral health program here, and we start working on getting a dental hygienist to the school or a location for the parents to bring, or however a community works it out. And at the end of the day, if the parent doesn't consent, well, let's start with just real quickly follow-up, the expectations of follow-up. Then we'll move into our questions.
Okay.
Follow-up as far as
if there's an issue that's flagged or concerned, Head Start's definitely going to know that there's some issues.
So let me just say, real brief. This policy is not to create more burden on school personnel. This policy is really, if the things work right, it should take the burden off the school. School personnel by ensuring that the kids don't have unmet dental needs when they come to school. We're working with the dentist, and Becky talked about the data entry piece, and that's something that we're developing now, and something that the dental providers will actually be entering that information. So the school personnel or school nurses, that's not something you'll have to input. Now this year there might be some back end input if we get trying to get the assistance in place. But but this is a work in progress. That data system it's kind of similar to the Head Start form now. The questions just kind of ask, is there untreated decay? Is there treatment urgency? So that gives us a chance to do follow-up care and care coordination.
Us, and when he's saying that, us would go to DHHR would have access and start working on that piece and moving forward. So that's the great piece about it. It moves back into the hands of public health to try to coordinate those services because we know school personnel are busy.
And I'll say we have, and I did mention, we have dedicated staff through, again, this oral disease prevention project to provide those care coordination services. We'll utilize the data that we collect when we get those assessments that says there are urgent treatment needs or those students that we see have not had an exam, and we'll be able to generate those lists, county-specific, school-specific, grade-specific, so that we will be able to begin that care coordination process and work with all of both school personnel and, again, the private sector to make sure those either treatment needs or those just basic preventive exams are being done, cleanings, things of that nature. So we're fortunate to have dedicated staff within our state health department to be able to provide that care coordination piece.
And at the end of the day, when you've tried to get the dental exam, at the end of the day, when you've tried to get a consent for a dental assessment, you've done what you can to try to facilitate basically the student getting to a dental provider and having prevention in their oral health care and needs. And that's all we ask of you at the end of the day. So, of course, with Head Start, they're going to have to continue to work and try to get that in hand because they go into federal reviews and everything else. So being reminded of that. But we are just trying to do some good promotion around oral health.
I mean, I don't see Head Start, any changes in the way Head Start's currently doing things. Anything just in the system, being the system.
Absolutely. Like I was going to say that I think your point is well taken. That Head Start is all about promotion at the end of the day, health promotion, and it's about trying to support children and families in getting the services they need, and this is no different. And so I see that this being yet another great partnership between the school system and Head Start and the DHHR and the medical provider, the dental providers, just an overall promotion. So it's great.
Okay, and we're going to move right into the questions, and I'm going to start with the first question here as we, and we'll try to get through these, and we thank you all for being patient with us. And here's the first question. If they have a dental exam in pre-K, another one in kindergarten, and I know, Marianne, we spoke to that after you had sent in the question, but no, they do not. If they've already given you a dental examination in pre-K entry, they do not need one for kindergarten. Only new enters in kindergarten.
Well, I mean, they don't need proof of an examination. We would hope that they would see the dentist twice a year. But no, you've done your job.
Yeah. Thank you. He's keeping us in line. And the child accomplishment summary, y'all started
in third grade.
We'll tell you it's on there to remind the parent that your child needs to see the dentist twice during the year, and it also gives them a place to go and try to find a dental provider. We'll be working on that as well to make sure we have the best website available to find a dental provider. Sorry, proof only. Thank you, Dr. Roush.
Yeah.
So can for a dental but not require it? What happens when they don't get the dental? Basically, just like the health check, we want to tell a parent this is part of enrollment criteria, and it is a should. It's not that they're going to be put out for it, but it should have. So we should be asking for it as a requirement for general enrollment, the dental exam with the health check and the immunizations. At the end of the day, we know immunizations are a public health threat. We can be communicable, and we can cause great harm to other children who are medically fragile, to infants, and to elderly in the home. So they have to get their immunizations. But at the end of the day, we know we will work with them on their oral health needs and on any of their medical needs, including specifically the ones that cause educational deficits. And that's part of our child find. So should we ask our current pre-K parents to have their child to get an oral exam prior to starting kindergarten? They do not need proof, as we just spoke about, but we always encourage you to welcome that. And as we do child accomplishment kindergarten. That will be another thing that we place on the health, is it health and social, as we move,
we're looking at that
as we move forward and continuing to promote a dental exam. So, yeah.
What would you mind reading that question again? Because I'm wondering if they're meaning transition activities for the children who'll be entering kindergarten in 15, 16.
So should we ask our current pre-K parents to have their child to get an oral exam prior to starting kindergarten?
They would not have had to have shown that to enter pre-K this year.
Right. So they would.
Yes, they would
technically need to do that.
Mm-hmm.
Right ahead.
I mean, is that
I'm not
correct?
speaking in slang. I'm not.
If they're in pre-K this year, they need to provide it for kindergarten next year.
because it's the 15-16 rule.
Right, because they'll be
Enrollment.
Oh, yeah. Thank you. Thank you. Thank you. Fully understand. Okay, so we're looking at kids in pre-K right now who have no dental exam requirement. They will technically be a new needing to do that for kindergarten. They're not a new enter, but still we will be wanting to see their dental examination. Okay. Sorry about that. A little slow on the up.
That's what happens when you have to work with technology piece too.
Yeah.
So the new children that come in this school year for pre-K have a dental exam. Then when they enter second grade, they will be required to obtain another current exam, and so on and so forth for grades 7 and 12, so that we are keeping up with their dental throughout their school life. Exactly. We are just doing checkpoints and making sure they are seeing a dental provider for preventative care. And we also, this gives us an opportunity with care coordination to support families who may have transportation issues, who may have cost issues, so that Dr. Roush and Teresa can keep writing great grants and ask the legislature, or looking at funding that may even be within our state to assist as we move forward. So we have to know what the needs are and where they are before we can try to redirect funds.
And as Becky mentioned before, there is a new service contracted through Medicaid for non-emergency medical transport, and that is for any covered service for Medicaid, which would include those children who have dental insurance through that system. So that could be, again, another, as she said, utilizing, we have to utilize what we have, and not underutilize it. We need to, promote these things. So that's something that is available. We heard a presentation on that within the first month. I believe that started October 1, and they already had like 50,000 requests that had went through. So it's becoming more, people are utilizing it, and that's what we want to when we have opportunity to use those things. So that's just another example. If the problem is access, physical access from somewhere, that would be something particularly to be used for that population.
And we have a few more questions if you can bear with us. What if the parent refuses enrollment in the dental prevention project? And if they refuse enrollment, like we said, you've made your good faith effort in trying to do dental prevention, we'll continue trying to notify that parent through the child accomplishment summaries that they should be seeing a dentist twice a year, and then know that we have the other checkpoints. So nothing more to do with Dr. Roush said. We don't want to cause more of a burden on school personnel. We just want to try to make sure kids have good oral health care. So who pays for the dental hygienist coming into the school setting?
Well, that's a great question. So who pays for it? So the hygienist can be, well, typically they're going to have to be a collaborative agreement in place, so that they could be employed by. They could be employed by a health department. They can be employed by an FQHC. They could be employed by a private dentist. So they, and the way the collaborative agreement works is the billing is through a dentist. So there still is the sustainability piece because the dentist can actually bill. So somebody will employ the hygienist and the dentist that has the collaborative agreement. So they'll do the billing. So there's several ways that can be done, but there's still going to have to be a dentist involved.
And we also, Becky mentioned a little bit, and again, we don't want to go too far into it, there is potential in the near future for financial support for counties to assist with this project. We've also received some funds which will be coming in within the next year to assist offsetting some of the costs for sealant placement for our underinsured or uninsured population to reimburse the cost of materials to be able to do that. So again, we're exploring those options, but it is something that it's a model that we hope can be sustainable through billing for services.
Mm-hmm. I would also like to mention here that, again, because Head Start has always had oral health as a component to its programs, that most Head Start programs are knowledgeable of or have relationships with providers in their area, and or they also may have individuals with that expertise that serve on health services committees that are required in the Head Start program. And so I would once again just put a plug in for the local collaborative teams to have this conversation to say, how is this currently working or not working for children already enrolled in Head Start, and see what opportunities there you may have. So I would just mention that as well.
As part of that project, there has to be a collaborative, a MOU in place between a dentist. So the mechanisms there, that's all kind of in that manual. But yes, a hygienist will be reimbursed. I mean, not through through billing, but through an employer.
Great. What do we do for students who transfer from out of state? If they're not in the grades as we phase in, if they're not in pre-K or kindergarten, if they're in the other grades, that wouldn't be a requirement. As we start to phase it in, if they're in 2nd, 7th, or 12th and it's already been implemented, it would. Do we ask for dental exam records at enrollment in any grade, not just the target grades? No, we're just working with those target grades, so we don't want to, again, overburden the school system. So it would be in those target grades as they are phased in. If the dental exam is a public health requirement, do we have to use the HIPAA FERPA forms to share documentation? I think until we get the information out, I think that the dentist is going to want that. How do you all feel a consent? But I'll turn that one over to Dr. Roush. Great question.
I have a appropriate response at this time, but I would say that being that it's public health, that there's different laws. So we can identify kids, but we still need to do some checks on between the HIPAA and FERPA. But being that that's a public health program and measure, the laws are different.
And since we're newly implementing, I would suggest we go ahead and get the consent. I think that's a great, Allison asked that. I think it's a great question until we make sure we get the word out and help the providers understand. They understand immunizations, but the dental providers are brand new into all of this, and we just want to make sure it makes things flow easily for you. And then as we put that down more on paper and start sharing it. So, all right. Will the hygienists and dentists have the portable dental equipment, or do the counties need to purchase the equipment?
That's a good question. I don't know if anyone's on the call who again, we have the Oral Disease Prevention Project that is through federal funding from the Centers for Disease Control and Prevention. There was some monies. There was a request for proposal put out a year or so ago for specifically portable dental equipment to provide such services within the school setting. That has been the approach has been changed at this point because of difficulty securing that portable equipment. So when these mini grants or funds that we have talked about hopefully coming in the near future, that's going to be left up to the discretion of the county. If a county needs portable dental equipment to provide these services, they can apply for monies to be used toward the purchase of that dental equipment. But as we've talked about, and we know there are places and counties within the state that are successfully doing some of these services perhaps already, so maybe that need isn't for portable dental equipment. Maybe it's to support a dental hygienist in some kind of way. Maybe it's to support some type of data entry. Maybe it's to support an existing free clinic or uninsured, underinsured catch that a school system may already have. So each application, like Tracy said, you know what's going on in your communities, what's working, what isn't working. That potential funding will be for you to apply and show us in what way you need support. So we're not specifically saying that you have to get portable dental equipment, because some people already have it, is what we found out.
Okay. Where will we get the money to provide services? And I think we've answered that. Of course, at the end of the day, it'll be the public-private partnership, and we'll be working with Dr. Roush's program to help link it. Head Start is a family service provider whose primary responsibility is to track and transport these issues. Public schools do not have a family service provider. I think earlier Tracy touched in on that.
Yes, that is correct. That that is a type of staff that school systems usually don't employ or have. However, I think the point I was hoping to get across there is that with Head Start touching 60% of the pre-K classrooms through collaboration, that hopefully a large percentage of children can benefit, and therefore the overall pre-K system benefit from having family service workers, family support staff. Again, their titles are different in each program, to support particularly, this issue beginning in the fall. They're already doing that currently for the Head Start requirements. Now, I'm not saying that they could suddenly, the existing family service workers suddenly help with every pre-K enrolled child across the state, because the capacity for that's very different, and every local collaborative team works with that issue already. Some may be able to achieve that and some may not. But I do mean that pre-K has an added benefit of having that staff present for those children that at least they touch. So.
And initially it is a team effort, and counties work that out. And at the end of the day, it'll move back over to a oral health case coordinator when we get into the assessment piece, or they don't have a dental exam or an assessment.
Yeah.
Okay. Will there be a consent form for the student to be enrolled in the West Virginia dental program for the assessment?
Yes, yes, it is in the toolkit or manual that we mentioned before for the oral disease prevention project.
Okay. Yeah. If we have proof of the exam from pre-K and K, do they need to show proof again when they get into 2nd, 7th, and 12th? Yes. Those are points that we need proof. So we know it's not a new entry point. They're progressing to the next grade, but we will need to show proof again at 2nd, 7th, and 12th. Where can we locate the pre-enrollment HIPAA consent form? We're going to give that to Janet, and she's going to post it on the website.
And I had a question emailed to me a few minutes ago from a couple of folks who had issues logging on, and they wanted to know when the webinar would be posted with these resources. And as soon as possible, but by Monday afternoon, we have to take it to our IT person, and then they have to upload it. So it doesn't take very long to get up there. So by Monday, it should be there.
Right. The 2nd, 7th, and 12th grade requirements are for all students or for newly enrolled students. No, those would be for all students progressing to 2nd, 7th, and 12th grade. Checkpoint. What are the child accomplishment summary? Are you referring to the checklist for the school entry with health check, immunizations, and etc.? So on the line, we have lots of school nurses who are looking at what is a child accomplishment summary.
Okay, so the child accomplishment summary is in place for West Virginia pre-K, and it basically is the family communication report that pulls data from a lot of different places. It's been in place since we started it in 2010-11. We really went full scale with it. It was 2011 after we got everyone trained and everything on its use. But it pulls the data that is from, looks at the health check data that's been entered and so on, and it gives the families a picture of the status of their child, not just with academics, but with, of course, regard to You know, in the past we looked at, are your immunizations up to date, or if not, what are you missing? And we know that with the transition of looking at the immunizations being entered in West Virginia SIS, we're working with our IT people, and Becky's done a phenomenal job of continuing that conversation with folks. So at any we're looking at the components that could potentially be part of that with regard to kindergarten and in the future grades 1 and 2. So.
Thank you, Monica.
You're welcome.
Okay, another.
Just to make sure, can someone let us know if you can hear us? To type in. I love technology.
Okay, thank you, Carrie. All right.
Thank you.
And we just have 2 more questions here. We'll get to those. I'm going to go, where can we get the toolkit? It's going to be posted on the website, hopefully Monday afternoon is what we're looking at. And I will also be sending that out as we get things completed to school nurses, and we'll do a superintendent announcement when it gets final, and we'll also do principals. So we will get it out far and wide, but as of Monday, we'll post the sample toolkit without the completion of the graphics department.
And I would say, too, this is Teresa. Becky and myself are listed as contacts at the end of this PowerPoint presentation. Part of our reporting for this project is to test the toolkit. So that's why we wanted to share the draft with everyone. We would appreciate your feedback. I've asked Janet for the questions, the FAQs, if we need to add any questions, because we've had some good questions today. But if you, looking through those documents, if you have any suggestions or feedback, or you find a period that we left out or whatever, it's better to have a lot of eyes on it. So feel free to email me and let me know so that we can make those revisions if needed.
Okay. And so it sounds like it's going to be a fluid document. We're going to keep adding as you all see what are the needs and how can we help you. All right, and our final question here says, what does the fluoride programs in school that don't, who does the fluoride programs in schools that don't have a school nurse in the building? Any recommendations?
The program itself is up. It does not have to be a school nurse that heads up that program. Our regional health coordinators, regional oral health coordinators, again, through partnership with Marshall University, and that is going to be something that is going to be part of the toolkit as well as we move forward, is we have a nice map of those 4 regions throughout the state and the points of contact for each of those regional oral health coordinators. A person just needs to be trained to be the lead person for the fluoride program at the school, and then they can any training needed to anyone else, particularly like classroom teachers who may have that going on in their classroom as part of the school day. But it does not have to be a school nurse, and we'll have contact information for those regional oral health coordinators if you would like to set up that fluoride rinse program in your school.
Okay, and our last question is, what is the website? The website is listed in your registration email as well, but here, if you all can see the screen, Janet's pulled it up on her computer here. Okay, wvd.state.wv.us/RESA-leadership.php. So we'll make sure we get that to you as well. Okay, and we're going to go ahead and again put up our final slides. We thank everyone for participating and encourage you to please call Teresa Marks or I. Just want to say a quick thank you. And please contact Teresa Marks at the Oral Health Program at DHHR or myself if you have questions. And we thank you all. And we know this is just the start of many questions and many technical assistant calls and emails. So we are glad to help in any way. And you know you got friends and partners around the table who will get questions to us and help us resolve any concerns or any needs.
And I want to end by thanking Dr. Roush, Teresa, and Becky for facilitating this webinar, and those of you out there who invited your partners, your school nurses, other administrators to be a part of it. I just wanted to thank you, because the more opportunities we have to share the information, we'll be able to better support children in this process and families. So thank you and have a good Friday.